So here we're going to use a technique to work the back of the hip, the lateral hip, and also the front of the hip. So this is very much a multifaceted technique that can be used for different things. So I'm going to grab Kiki's ankle, foot, slightly extend just to allow me to slide my hand under her knee. And I'm just going to slide her leg into flexion, about here. So she's about 90 degrees. She probably can go higher. She has good range of motion. So from this position, as you can see, there's not a lot of space here in Kiki's hip. So her hip stays pretty low to the table. That suggests that she has good capsular mobility in the front of the hip. What you might notice with some of your not so mobile clients, as we come here, she does that. And that's a sign of a tightness in the capsule. So first technique, we call this the Soco hip technique. Soco, S-O-C-O, like the scene of crimes office, when they have the murder victims and they have them painted in that weird shape. So we're gonna grab the foot, here. I slide the leg to 90 and beyond, if possible. I use my foot to brace. So this is pretty comfortable for the client. So the first things we're gonna go for, we're gonna locate the sacrum. So I'll outline the sacrum with my thumbs, and I'll come in with a very soft elbow, and I'll just work with the bony attachments of the glute max, piriformis. So here, obviously, the glute is on stretch. The glute is an extensor of the hip. So by moving Kiki into flexion, the glute maximus is on stretch. So we want to work along the bony outcropping of the piriform of the sacrum. Work all the way down. Then what I like to do is to move out to the greater trochanter. Come in here. And I'm just framing the bone. So I'm starting on the underside of the trochanter. A lot of insertions here. Piriformis key insertion point. And we just frame around the bone. Here. Come on top. Key thing is for us, just keep our bodies safe. I can change my legs, but for camera purposes, I'm not sure if this works, and be in here. Notice I'm nice and low, both hands are on the body. I can use my other hand, this hand, to manipulate the posture, the movement of Kiki's leg. Feels okay? Mm-hmm. So here my intention is the soft tissues of the hip and along the bony line of the sacrum. But if a client came in and they got a very elevated hip here, we'd want to create some traction, some motion in there to work the capsule. And all I'll do here, frame the sacrum, the trochanter, and I'm doing nice straight arms. I'll take a deep breath in, they take a deep breath in too actually. Breathe out and I'll just push down. Just taking up the slack. We're trying to find that end feel of the hip. It should be slightly firm with a little bit of spring here. So I'm just pushing here. 1, 2, 3. You can come in obviously with an elbow and the same intention. So now I'm not thinking muscles, I'm thinking hip capsule. So when I'm working muscles, I'll be working obliquely this way, but now I want to work the capsule. My pressure is down, I lean, and I can even lift the knee here, just to create some extra motion. If you're doing this technique, you're going to be here 3 or 4, 5 minutes. Have them come in and out of that posture, just to give them a break. So again, just lift the knee 1 inch, slide under, external rotation, slide up, block, and do your work. Block, do your work here. So in this position, the capsule is taut in some positions because we're in relative rotation here, relative internal rotation. So that's going to keep the capsule somewhat slack, and the amount of abduction is going to keep the capsule somewhat taut, along with the abduction. But Kika doesn't have capsular issues, so her natural motion is to be pretty flat. I'm going to show you on the other side for camera purposes. Sorry, lift, grab, slide up. This one is a bit different. It's a bit higher, right? Is that a fake movement?
No.
So this is a entire hip. So now with this type of presentation, for sure I'm going to come in here and do the capsular work that I showed on the other side. Is okay? When you're working capsules, they generally respond to long, slow holds. So I might stay here 30, 45 seconds and then come out, frame this way. When you bring the client out of the posture, 2 hands, slide them out. It feels a lot different if you're just like fishing around under their knees, they feel uncomfortable. So this just a little bit of lifting, just a nice grab, and just cradle them in. And same when you come out, 2 hands, jostle and shake. So it's a great technique for the anterior hip, but also the glutes, the piriformis.